happens is basically if your fascia gets unhealthy, it starts to show on the outside of your body. So your fascia is under the skin, but you'll start to see it on the skin. For example, like the Dowwigger's hump is a fascia problem. When you start to get sagging under here, usually there's adhesions in here that are causing issues, or adhesions in here that are causing issues. When you get these points right here that are kind of like your fat, or what do they call that? Your spare tire. That's also just it's an accumulation of fascia which traps the fat in that area. And again, on the belly we have our visceral fascia, and then there's so you can have an effect on all these different parts of the body. Specifically, what I've been working on a lot are the legs, right? So the legs as you get older too, and it doesn't matter whether you're skinny or overweight. Fascia, unhealthy fascia is going to create the pockets that look like cellulite on your body. So one thing that we can do, I'll just go ahead and start the demo now. One thing we can do is oil, obviously, because you don't want friction with the tool. So you take the tool, and I start by scrubbing, right? So this breaks up the fascial adhesions and starts the process of getting blood flow going, right? And so I'm on that IT band area here. Almost everyone has pain here, and these are the saddlebags. Yeah, this is where people get those extra fibrous kind of pockets that end up looking like you've got saddlebags on your legs, and then usually that becomes cellulite as well. So once you get it, when I say when you get it to the point where you're ready to move on, I mean that you start to feel a little bit of heat. There's some heat that I'm feeling, and it feels like things are starting, blood flow is starting to happen, and innervation, you just start to sense and feel. So you can go across the grain, you can go with the grain, and then of course you can tip and peel. Right? So I just alternate between all of these things. And then the next phase would be to separate out all those layers, with the layers of the fat and the fascia and the skin. So I take my cup and I squeeze it and place it on there, and now it's just stuck. And then I'll just start to pull. And this separates out all those different layers. And you'll see it will turn really pink, and you're getting a lot of blood flow. So I'm just going over the same spot that I just scrubbed, pulling it all apart now that it's broken up. Right? So now it's all pink. You can see that there's a lot of blood flow in there. And then once you break up something and you pull it apart, the idea is then to use the flusher and let it know what the right direction for it all to go and flow is, by just gently flushing toward whatever joint.